Good evening. This is Finest. Right now, I'm in the facility getting my second treatment of ozone therapy. As you guys remember, I mentioned a while back on my blog that I went to the HIV specialist, and they did an anal swab. And upon them doing the anal swab, like several weeks later, they said that I had abnormal cells. So they referred me to the colorectal doctor. I didn't know why they was referring me to the colorectal doctor at that time, but when I got to the colorectal doctor, they performed some tests and they examined my rectum, and they said that they saw some warts. So when they examined my rectal area and saw some warts, they said that I could possibly, they said more than likely, I have HPV. And they said that this could turn into cancer. So they tried to tell me that I need to get surgery because if I don't, this could possibly turn into cancer. So I was like, at that time, I was like asking them questions about how much is this surgery. They told me like $15,000. I said no, I cannot afford that. And then they said that with this discount, it would knock it down to $4,000. I said I still don't have that type of money. So I did research on Google, and upon my research, I discovered that this treatment called ozone therapy. I was like, since I'm doing since I'm doing an holistic approach to curing HIV, I said, why not do an holistic approach with getting rid of this wart that was in my anal area? So here I am right now. This is my second treatment, as I mentioned before. Getting my second treatment of the ozone therapy, and the first treatment was pretty successful. I didn't experience any pain or anything like that. Upon Before doing the ozone therapy, you have to make sure you douche and clean out. It's almost like a colonic in a sense, because you don't want to mess when you get this catheter inserted in your rectal area. But right now, I have my physician assistant. Her name is Amber, and she's going to explain what is ozone therapy and what are the benefits of ozone therapy.
Okay. Well, ozone is oxygen with an extra oxygen molecule. Oxygen is O2 and ozone is O3. So what happens, you take medical grade oxygen and you run it through a machine called an ozone generator, which produces electricity, and it separates the molecules of oxygen into three separate molecules, and then it recombines them into O3, which is an unstable gas made up of about 98% oxygen and 2% ozone. Ozone has many practical uses for many different types of autoimmune diseases, and has been used successfully in Europe and South America since the early 1900s. The only reason it hasn't gotten more popular in the United States is because it cannot be patented by any drug company, therefore they can't make billions and billions of dollars off of it. It's very affordable, it works very well, and it has minimal to no side effects. And as we know, all healthy cells need oxygen, and the most reason that infections occur is because cells are invaded by anaerobes, which are germs that do not thrive in an oxygen-rich environment. So when you use ozone therapies or oxygen therapies, you are not only detoxifying your body and killing germs and viruses and funguses and parasites, but you're also boosting your immune system at the same time. So, many people have found that not only is ozone one of nature's most powerful antioxidants, it can be used in water purification, it can be used in home air purification, and it has been applied medically in Europe to treat everything from non-healing wounds to colitis, cancer, stroke, and even HIV and AIDS. The ozone the ozone that we are using is the same ozone that makes the sky blue in the atmosphere, and the ozone shields us from ultraviolet light from the sun, and it helps oxidize pollutants in the air that are produced via electrical discharge and by power plants and just chemicals that are in our environment that we're breathing, drinking, eating in our food and soil. So what the ozone does is it helps us detoxify and also heal at the same time.
Okay. So as far as like, um, uh, what's the difference between getting it inserted, the ozone treatment in the rectal area and the bloodstream? I know you said that.
Mm-hmm. Ozone can be administered in the body in several different ways. The most popular is probably through the bloodstream through an IV called autohemotherapy, in which an IV is started on a person, blood is withdrawn from the vein and mixed with normal saline into an IV bag, and then the ozone oxygen gas mixture is then injected into the IV bag that holds the blood. It's mixed together and then it is auto infused back into the patient. This is called minor autohemotherapy, and this has been used successfully all over the world for over 50 years. I was trained by Dr. Frank Schallenberger, who has written many books on the uses of ozone, and the main difference between having ozone done in your bloodstream or having ozone administered through the rectum is that if you have bad veins, or if you're afraid of needles, or you're just uncomfortable with having your blood drawn, the rectal insufflation of ozone is 97 to 98% as effective as having ozone done in the bloodstream. The only difference is you want to make sure that you've had a bowel movement 6 to 12 hours prior to the treatment, or if you have problems with constipation, you would want to do an enema, either saline or coffee prior to the treatment, just to make sure your distal colon is cleaned out. That way you get a better absorption of the ozone into the mucous membranes of the rectum. The reason that the rectal insufflation works so well is because you have a lot of veins inside the rectum, which then connect to larger veins, which connect to the portal vein, which then connects to the liver, and so the ozone that way is absorbed into our central circulation, very similar as it would be if you were to do it in your bloodstream. A lot of people prefer the rectal insufflation route because it doesn't take very long to do it. It's about a 10 to 15 minute treatment, and there's no needles involved. You just use a silicone catheter that is lubricated with KY jelly, so it's not uncomfortable, and the person is instructed to try to hold the ozone gas for about 20 minutes after the treatment, and not to pass gas or have a bowel movement for that 20-minute period, because that's the amount of time it takes for your body to absorb the gas.
That was a challenge, guys. When I did that 2 days ago with 30 minutes, oh gosh, that was a challenge.
But you did it.
Yeah, I did it. I was able to hold it. I'm trying to get as much absorption of this ozone as much as possible to, kill this herpes, this HIV, whatever viruses and bacteria that I have in my body. I'm trying to get an HSV. I'm trying to get rid of this thing, and I will. But I must be consistent with Dr. Savi's diet, upon being consistent with the ozone treatment, things of that nature. So I'll talk to you guys later. All right, take care.